So now we're going to be continuing with the third part for Chapter 10 on the muscular system. If you haven't seen the previous two videos, please be sure to check them out. The links are, you can find them in the description below. In addition to that, you will find them in the playlist. If you have any questions, please email me, or again, you can leave them in the comments area below. Also, you can send me a message through YouTube or on Facebook as well. You can find the link for my social media information in the description below. Now we're going to be looking at the deep muscles of your thorax. And the primary functions of the deep muscles of your thorax is to promote movements that are necessary for breathing. Now breathing, it consists of two phases. When we breathe in, that's called inspiration. Okay, we also refer to that as inhaling. And when we breathe out, which is referred to as commonly exhaling, in medical terminology, it's called expiration. Okay, so inspiration is inhaling and expiration is exhaling. Now, this is caused by the cyclic changes in the volume of the thoracic cavity. There's two main layers of muscles that help form the anterior lateral walls of the thorax. Now, the thoracic muscles are very short. Most of them, they extend only from one rib to the next one. And when these muscles contract, they pull the ribs a little bit closer together. The external intercostals, these are considered to be the muscles that help you breathe in, so they're referred to as the inspiratory muscles, and they form the more superficial layer. And when they contract, they lift the rib cage, and they also increase the anterior to posterior and side to side dimensions of the thorax. The other muscle, the internal intercostal muscles, they form the deeper layer, and they aid in the forced expiration by depressing the rib cage. But under normal conditions, expiration is largely passive. It results from the relaxation of your external intercostals, the diaphragm, and the elastic recoil of the lungs. Now, the most important muscle for inspiration is the diaphragm. In addition to that, it also forms the muscular partition between your thoracic and your abdominal pelvic cavities. When the diaphragm is relaxed, it takes the shape of a dome. But when it contracts, it moves inferiorly and then it flattens. And what this does is that it increases the volume of the thoracic cavity, and this allows for air to enter the respiratory systems of passageways. This rhythmic contraction and relaxation of the diaphragm, it also causes pressure changes in your abdominal pelvic cavity, and it helps return blood back to the heart. You can also contract the diaphragm voluntarily to push down on the abdominal viscera and increase the pressure in the abdominal pelvic cavity. And this helps evacuate the pelvic organs' contents, like urine or feces. In addition to that, again, when a woman is giving birth, this also helps expel the baby out of the abdominal pelvic cavity. And here we have illustrations of the external intercostal and the internal intercostals. So you can see that the origin is the inferior border of the rib above, and the insertion is the superior border of the rib below. And now both these external and internal intercostals, they're innervated by the intercostal nerves. Your diaphragm is innervated by the phrenic nerve. It's a common test question you'll see over and over again on the exams, so keep that in mind. So the action of the external intercostal, it's to pull the ribs towards one another, and it helps elevate the rib cage. And remember, this allows the air, it helps the air to enter the respiratory passageways. And it's a synergist of the diaphragm. Now, the internal intercostals, it's going to insert at the inferior border of the rib above, and its origin is going to be the superior border of the rib below. So it's kind of somewhat opposite, because now what happens is they both run at both these muscles, they're perpendicular to one another. Remember, this is the deeper layer, and this is the outer layer. So this runs perpendicular to this layer deeply. And when the internal intercostals contract, they bring the ribs together to depress the rib cage, and this aids in the forced expiration. So it's antagonistic to the external intercostals. So we have 11 pairs of both of these muscles, that meaning 11 pairs of the internal intercostals and 11 pairs of the external intercostals. And as I said before, they run perpendicular to one another. The external intercostals, they run down and forward, and the internal intercostals, they run downwards and posteriorly. Now this illustration is showing you the image of the diaphragm. So as you can see, this is a broad muscle. It's pierced by openings for the inferior vena cava, which is a blood vessel or the vein that returns all the blood from the lower part of your body back to the heart. Also, there's an opening for your esophagus. This is the tube that runs from your mouth down your throat into your stomach. And in addition to that, there's another opening here for the aorta, and this is the largest artery that's leaving your heart, and it's going down into your lower part of your body. Okay, this aorta, it's running inferior. So this muscle is forming the floor of the thoracic cavity, and in the abdominal pelvic cavity, it forms the roof or the ceiling of it. The origin is the inferior internal surface of the rib cage and the sternum, the costal cartilages of the last 6 ribs, and the lumbar vertebrae. And its insertion is the central tendon. And remember, it's innervated by the phrenic nerve. And this is a prime mover of inspiration. It flattens on contraction, which causes an increase in the vertical dimensions of your thorax. And when it's strongly contracted, it dramatically increases the intra-abdominal pressure. So this is a picture of a cadaver, and what they're showing you the diaphragm over here. So this is the muscular part of the diaphragm, and you can see the central tendons of the diaphragm. This is going to be your thoracic vertebrae, and these are the 2 blood vessels. So this is the inferior vena cava, and this is the aorta. This blood vessel is returning all the blood from the lower part of your body back to the heart, and this is the blood vessel that's taking the blood away from the heart, the aorta. And this is where the heart's going to be sitting over here in this pericardial sac. And you can see a part of the pericardium that's left over here. And in addition to that, we can see, I'm not sure if I mentioned, but this is the thoracic vertebrae right over here. Be sure you view these animations. Either go to the website for Pearson, or if your book came with the DVD, look at that. In addition to that, you can search for it on YouTube. And this is going to be showing you the actions of the external intercostals. And this next video is going to be showing you the actions of the internal intercostals. So again, please be sure to view these videos. They will be helping you significantly in studying for this, and also ultimately in your retention of the material. Now we move on to the muscles of the abdominal wall. And these muscles, they allow for trunk movement and compression of the abdominal viscera. Now, unlike the thorax, the anterior and lateral abdominal walls, they don't have any bones to reinforce them with. Instead, these 4 paired muscles, they just have their fascia and aponeurosis that they're consisting of. We have 3 broad, flat muscle pairs that are layered one on top of the other that form the lateral abdominal walls. The fibers of the external oblique muscles, they run inferior medially and at right angles to those of the internal obliques which underlie it. The fibers of the deep transverse abdominis muscles, they run horizontally across the abdomen and at an angle to both. These 3 muscles, they blend into this broad insertion aponeurosis anteriorly. The aponeurosis, in turn, it encloses the 4th muscle pair medially, which is the rectus abdominis muscle. The rectus abdominis, it then fuses, forming this linea alba, which is a tendinous seam, which runs all the way from your sternum down to the pubic symphysis. The abdominal muscles, they protect and support the viscera most effectively when they're well toned. When the muscles are weak or when they're severely stretched, as when you see in women when they're pregnant, they allow the abdomen to become more pendulous. So it allows it to take on this more pot-belly shape. As we discussed in the previous slide, the fascicles, they're all running at angles to one another, and this is what provides these muscles with additional strength. They're all innervated by the intercostal nerves as well. Actions of these muscles include lateral flexion and rotation of the trunk, and flexion of the trunk against resistance, as we get in during sit-ups. Now, during inspiration, the abdominal muscles, they relax, and this allows the abdominal viscera to be pushed inferiorly by the descending diaphragm. When these abdominal muscles, they contract, several different activities could be affected. For example, when they contract simultaneously, the ribs, they're pulled inferiorly and the abdominal contents are compressed. This pushes the visceral organs upwards on the diaphragm, and this is what aids during forced expiration. Now, when the abdominal muscles, they contract with the diaphragm and the glottis is closed, the increased intra-abdominal pressure, it helps promote urination, defecation, and childbirth. So here you can see the abdominal muscles, and the muscles of interest to us are the ones that are in bold here: the transverse abdominis, the internal obliques, the external oblique, and the rectus abdominis. So let's look at this first one, this rectus abdominis. So for this muscle, the insertion is going to be the xiphoid process and the costal cartilages of ribs 5 through 7. And its origin is going to be the pubic crest and the pubic symphysis. It's innervated by the intercostal nerves, and its actions include flexion and rotation of the lumbar region of your vertebral column. It fixes and depresses your ribs and stabilizes your pelvis during walking. It also increases intra-abdominal pressure that we use when we're doing sit-ups and curls. The external obliques, these are the largest and the most superficial of the three lateral muscles. They're fibers that run downwards and medially. This is the same direction when you take your hands and you stick them in your side pockets. So the direction that your fingers are running, that's the direction that this muscle runs. The aponeurosis, it turns under inferiorly and it forms this inguinal ligament. The origin is by the fleshy strips from the outer surfaces of the lower 8 ribs. And for the insertion, most of the fibers are inserted into the linea alba via the broad aponeurosis. Now some, they also insert into the pubic crest and the tubercles and the iliac crest. When the external obliques contract as a pair simultaneously, they flex the vertebral column and they compress the abdominal wall. This increases the intra-abdominal pressure. Now, when they contract individually, they aid the muscles of the back in trunk rotation and lateral flexion. This is what we're using when we're doing our oblique curls. The internal obliques, most of the fibers, they run upwards and medially. However, as the muscle fans, its inferior fibers, they start running downwards and medially. Now, its insertion is the linea alba. Okay, this is the linea alba over here. The pubic crest and the last 3 or 4 ribs and the costal margins. The origin is going to be the lumbar fascia, the iliac crest, and the inguinal ligaments. And functions will be the same as for the external oblique. Now for the transverse abdominis. This is the deepest and the innermost muscle of the abdominal wall. And as you can see over here, the fibers, they're running horizontally. Now the origin for this muscle, it's going to be the inguinal ligament, the lumbar fascia, cartilages of the last 6 ribs, and the iliac crest. Its insertion is going to be the linea alba and the pubic crest. Its function is to compress abdominal contents. So in this image, you can see the external oblique, the rectus abdominis, the internal obliques. And notice the directions, again, for the internal oblique and the external oblique. So, and then in addition to this, so they're all at different, they're at different directions. So this crisscrossing pattern is what gives these muscles this additional strength. Then over here, you can see these transverse abdominis, which are completely horizontal. And here's another image, another picture that's showing you the same muscle. So here's the transverse abdominis there, and then you have the internal obliques, which is showing you that it's the deepest. And then the intermediate, you have these the rectus abdominis muscle over there, and then you can see again the internal obliques over here. Now we're going to be looking at muscles of the pelvic floor and the perineum, which provide support for the abdominal pelvic organs. Now these two paired muscles, the Levator ani and the Coccygeus, they form the funnel-shaped pelvic floor, or also known as the pelvic diaphragm. The pelvic diaphragm, it functions to seal the inferior opening of the bony pelvis, it supports the pelvic organs, and it lifts the pelvic floor superiorly to release feces. In addition to that, it also resists the increased intra-abdominal pressure. It's pierced by the rectum and the urethra, and in females by the vagina. Now, the body region inferior to the pelvic diaphragm is the perineum. Inferior to the muscles of the pelvic floor and stretching between the two sides of the pubic arch in the anterior half of the perineum, we have the urogenital diaphragm. This is a thin triangular sheet of muscle that contains the external urethral sphincter. Now, this muscle, it surrounds the urethra and it allows for the voluntary control of urination. Superficial to the urogenital diaphragm and covered by the skin of the perineum, we have the superficial perineal space. And here, we find the ischiocavernosus and the bulbospongiosus muscles. These are the two muscles that help maintain erection of the penis and clitoris. As we move to the posterior half of the perineum, encircling the anus, we have the external anal sphincter. And this muscle, it allows for the voluntary control of defecation. Now, just anterior to this, we have the central tendon of the perineum. This is a strong tendon into which many of the perineal muscles insert to. So the Levator ani muscles and the Coccygeus muscles, this makes up the pelvic diaphragm. So let's start off by looking at this first muscle here, the Levator ani. Now, this is it's very broad, as you can see. It's a broad, thin, tripartite muscle. So it's got 3 parts that it's made up of. And 2 of those you can see over here. One of them you can't see because it's a little bit deeper. And they are the pubio coccygeus, and then you have the puborectalis, which isn't shown. And then we can see over here is the iliococcygeus. It has extensive linear origin inside the pelvis from the pubis to the ischial spine. For the insertion, it's the inner surface of the coccyx, the levator ani of the opposite side, and partially into the structures that penetrate it. It's innervated by the third and fourth sacral nerves and the inferior rectal nerve. As for the actions, it supports and maintains positions of the pelvic viscera, so it resists downward thrusts that accompany rises in intrapelvic pressure during coughing, vomiting, and expulsive efforts of abdominal muscles. It forms sphincters at the anal-rectal junction and vagina, and it also lifts the anal canal during defecation. And lying posterior to the levator ani, we have the small triangular muscle called the Coccygeus, which forms the posterior part of the pelvic diaphragm. Its origin is going to be the spine of the ischium, and the insertion is going to be the sacrum and coccyx. It's innervated by the fourth and fifth sacral nerves, and its actions are to support the pelvic viscera. So it supports the coccyx and pulls it forward after it's been reflected posteriorly by defecation and childbirth. Now we're going to be looking at the muscles of the urogenital diaphragm. And the first muscle that we look at is this deep transverse perineal muscle. And as you can see, this muscle is much more broader and developed in females than it is in males. It spans the distance across the ischial rami, and its origin is the ischial rami. Its insertion is the mid-central tendon, and in females, some of the fibers insert into the walls of the vagina as well. It's innervated by the pudendal nerve, and its actions are to support the pelvic organs, and it does this by steadying the central tendon. The second muscle of the urogenital diaphragm that we're going to be looking at is the external urethral sphincter. And as you can see, it's encircling the urethra in both men and women. And the origin for this muscle is the ischiopubic rami, and the insertion is the midline raphe. And they're innervated by the pudendal nerves as well. What this muscle functions to do is that it constricts the urethra, so it allows for the voluntary inhibition of urination. And in addition to that, it also helps support pelvic organs. Now we're going to be looking at muscles of the superficial perineal space. And the first muscle that we're going to look at is the ischiocavernosus muscle. And it runs from the pelvis to the base of the penis or clitoris. Its origin is the ischial tuberosities, and in men, the insertion is the crus of corpora cavernosa of the penis, and in females, it's the clitoris. It's innervated by the pudendal nerve, and its actions is to retard the venous drainage and maintain erection of the penis or clitoris. Next, we look at the bulbospongiosus muscle, which encloses the base of the penis in males, and in females, it lies deep to the labia. Its origin is the central tendon of the perineum in females, and in males, it's the midline raphe. It inserts anteriorly into the corpora cavernosa of the penis, and in females, to the clitoris. It's innervated by the pudendal nerves, and for the actions, it empties the male urethra, and it also assists in the erection of the penis and the clitoris. Posterior to the vagina in females and the urethral opening in males, we have this superficial transverse perineal muscle. Its origin is the ischial tuberosity, and the insertion is the central tendon of the perineum. It's also innervated by the pudendal nerve, and its actions are to stabilize and strengthen the midline tendon of the perineum. Now we're going to be looking at muscles that are responsible for the movement of the scapula, and these are the superficial muscles of the anterior and posterior thorax. Most superficial thorax muscles are extrinsic shoulder muscles, which run from the ribs and vertebral column to the shoulder girdle. They both fix the scapula in place and move it to increase the range of arm movements. The anterior muscles of this group, they include the pectoralis major, the pectoralis minor, the serratus anterior, and the subclavius. With the exception of the pectoralis major, which inserts into the humerus, all other muscles of the anterior group, they insert into the pectoral girdle. The posterior muscles, they include the latissimus dorsi and trapezius muscles superficially, and underlying we have the levator scapulae and the rhomboids. The latissimus dorsi, it inserts into the humerus and is more concerned with movements of the arm rather than the scapula. The important movements of the pectoral girdle involve its elevation and depression, rotation, lateral movements, and medial movements. The clavicles, they rotate around their own axis to provide both stability and precision to scapular movements. With the exception of the serratus anterior, the anterior muscles, they stabilize and depress the shoulder girdle. The scapular movements, they're promoted by the serratus anterior muscles anteriorly and by the posterior thoracic muscles. The prime movers of shoulder or scapular elevation are the superior trapezius fibers and the levator scapulae. Now, when these muscles, they work together to shrug the shoulders, their opposite rotational effects counterbalance one another. The scapula is depressed largely by gravity, but when it's depressed against resistance, the inferior part of the trapezius, the pectoralis minor, and the serratus anterior, along with the latissimus dorsi, are contracting. Anterolateral movement of the scapula and the thorax wall, such as in when we're pushing or punching movements, this mainly reflects the serratus anterior activity. Posterior medial movements of the scapula is affected mainly by the trapezius and the rhomboids. Although the serratus anterior and trapezius muscles are antagonists in forward-backward movements of the scapula, they act together to coordinate rotational scapular movements. Now let's look at these muscles in detail, starting off with the muscles of the anterior thorax. So the first muscle that we're going to be looking at is the pectoralis minor muscle. This is a flat, thin muscle that's directly underneath the pectoralis major. Its origins are the anterior surface of the ribs 3, 4, and 5, or sometimes you have it between ribs 2, 3, and 4. The insertion is going to be the coracoid process of the scapula. It's innervated by the medial and lateral pectoral nerves. As for the actions, with the ribs fixed, it draws the scapula forward and downward. This is the prime movement for this muscle. And when the scapula is fixed, it draws the rib cage superiorly. Now let's look at the serratus anterior muscle. This is the fan-shaped muscle. It lies deep to the scapula and deep and inferior to the pectoral muscles on the lateral rib cage. It forms the medial wall of the axilla. Now its origins, they have this serrated or this sawtooth appearance. When this muscle is paralyzed, it's almost impossible to elevate your arm. Its insertion is the entire anterior surface of the vertebral border of the scapula, and its origins is by a series of muscle slips from ribs 1 through 8 and sometimes 9 as well. It's innervated by the long thoracic nerve, and as far as actions, the primary action is going to be to rotate the scapula so that its inferior angle moves laterally and upwards. It's also the prime mover to protract and hold the scapula against the chest wall. It raises the point of the shoulder, and it also plays an important role in abduction and raising of the arm and in horizontal arm movements. Finally, we have the subclavius muscle, and this is a small cylindrical muscle that extends from the first rib to the clavicle. Its origin is going to be the costal cartilage of rib 1, and its insertion is going to be the groove on the inferior surface of the clavicle. It's innervated by the nerves to the subclavius, and its action is to help stabilize and depress the pectoral girdle. I'm using the Zygote Body website again, and I wanted to kind of show you this. So you have your pectoralis major muscle right over here, and I'm just going to make this disappear. And here you go. This is your pectoralis minor muscle right over here. Okay, and then you can see it inserting into the coracoid process over here. And also you can see its insertion into the ribs. This is your 3rd, 4th, and 5th rib that it's inserting to over here. And then as we look at the side, these are the serratus anterior muscles. And again, you can see its origins over here on the ribs. And then as you go to the posterior aspect, you can, well, you can't see it. I'm going to make this. Here we go. I'm going to make this a little bit less visible. And there you go. Now you can see it. So here you can see it. It's how it's inserting into the scapula. And this is a subclavius muscle. So over here you can see its origin, which is the costal cartilage of your first rib. And the insertion is more difficult to see, but it's the groove on the inferior surface of the clavicle. So it's this groove that's over there. Again, you can't see it that well. And this is a cadaver, a photograph of a cadaver. It's showing you the same muscle. So over here you can see the pectoralis minor, and here this is the pectoralis major. So when you remove this muscle, as you saw in the zygote, you have underlying it, you have the pectoralis minor. And then you can also see the subclavius, and then you can see, well, you can see part of the serratus anterior over here. And be sure you view these the animations. Again, go to the Pearson website or the DVD, refer to the DVD that came with your book. And additionally, you can search YouTube for it as well. And there's another video over here that shows you, again, another video. And this is for the pectoralis, showing the pectoral girdle. And then this shows you this animation here shows you the picture of the pectoralis minor muscle. So be sure you view this. And then this animation shows the serratus anterior muscles. So be sure you check these out also. Now we're going to be looking at muscles of the posterior thorax. So we're going to start off by looking at this big muscle over here. This is the most superficial muscle of the posterior thorax. This is the trapezius, and it's a flat and triangular shaped muscle. The upper fibers, they run inferiorly to the scapula. The middle fibers, they run horizontally to the scapula. And the lower fibers, they run superiorly to the scapula. Its origin is the occipital bone of your skull, the ligamentum nuchae, and the spinous process of C7 and all the thoracic vertebrae. As far as insertion, it's a continuous insertion along the acromion and spine of the scapula and the lateral third of the clavicle. It's innervated by the accessory nerve, which is cranial nerve number 11, and also the third and fourth cervical nerves. As far as actions go, the primary action is to stabilize, raise, retract, and rotate the scapula. The middle fibers, they retract, which is abduct the scapula. The superior fibers, they elevate the scapula. So this is what happens when you're shrugging your shoulders. Now, when the scapula is fixed, it can also help extend the head. So this is when you're looking upwards. For example, when you go to the circus and you're looking at the trapeze act above you, this is the muscle that's doing that. Now, the inferior fibers, they depress the scapula and the shoulder. Next, we're going to be looking at this muscle that's located at the back and side of the neck. It runs deep to the trapezius, and it's a thick strap-like muscle that we call the levator scapulae. Its origins are the transverse process of C1 through C4, and it inserts into the medial border of the scapula, superior to the spine. It's innervated by the cervical spinal nerves and the dorsal scapular nerves, which are the third, fourth, and fifth cervical nerves. Its prime action is to elevate and adduct the scapula along with the superior fibers of the trapezius. It tilts the glenoid cavity downwards when the scapula is fixed, and it flexes the neck to the same side. Now we move on to these two roughly diamond-shaped muscles that are lying deep to the trapezius and inferior to the levator scapulae. These are the rhomboids. So the more superior is the rhomboid minor, and then you have the rhomboid major. Now the origins are going to be C7 and T1 for the rhomboids minor, and T2 through T5 for the rhomboids major, and they both insert into the medial border of the scapula. They're both innervated by the dorsal scapular nerve, which is cervical nerve 4 and cervical nerve 5. The main action is to stabilize the scapula, so they act together and with the middle trapezius fibers to retract the scapula. They also help rotate the scapula so that the glenoid cavity is downward, and this is what happens when you're paddling a canoe. And in this photograph of the cadaver, you can see the trapezius major muscle here clearly. Also, we can see the deltoid muscle, which you looked at, and then here's the teres major. And let's move on to the next muscle. And over here, we can see the rhomboids major. This is your rhomboids minor, and then we can see the levator scapulae. And also, you can see the teres minor over here and the teres major. So this animation here, again, please be sure to go to the Pearson website, and you can look at the trapezius muscles at work over here. In addition, there's another video here that shows the levator scapulae. Be sure to look at this. And another one for the rhomboids major, and this one's showing the rhomboid minor. And this other video here shows you the muscles of the pectoral girdle. So please be sure to look at these videos. Here's another one that shows movements of the pectoral girdle. Yeah, be sure you look at these videos. They're going to help you a lot in understanding what we just discussed and what we spoke about. And also you might see something mentioned on the exam that's coming from these videos. So please be sure to look at these. And finally, I'm going to give you another view of those muscles in the zygote body. So here you see this huge muscle here. This is the trapezius. And as you start to take away this layer, the trapezius, then you can see here, this is your the rhomboids minor, and then this is the rhomboids major over here. And then this right here is your levator scapula, right over here. And that's about it. So be sure you take time, and I would highly recommend that you guys come to this website, either the zygote body, or again, if you have a lab at your school, to go to the use the cadaver or the models that you have at your lab at your school. In addition to that, you can use other websites also that have these interactive 3D atlas. I highly recommend it, especially for learning bones, bone structures, and muscles, muscle structures, and joints. It's highly helpful and very effective in memorizing and learning these structures very well. So if you have any questions, again, please email me directly at my email address. You can find that in the description below. In addition to that, you can send me a message through YouTube. Also, you can follow me on Facebook. All that information is in the description below. And also, you can leave comments in the comments area. Please be sure to share this with your friends. Please be sure to subscribe if you haven't subscribed already. And thank you so much for watching these videos. The next couple of videos, they should be up within the next few days. And thank you so much for your support and watching these videos.